Welcome to RevoNose by Sculpture. RevoNose is a revolutionary method based on 3D planning, ultrasonic technology, and regenerative medicine with proven results in over 200 rhinoplasties each year since 2010. Let us explain the process. We use a 3D CT scan to perfectly reproduce the nasal structure in an anatomically correct image that will be used for reference during the procedure. With our surgical planning software, we will analyze the nasal bone structure and design the bone remodeling that will be performed during the procedure. This design is 3D printed into customized surgical guides, which will be used during the surgery for accuracy and precision. Also, the shape of the nasal septum and turbinates will be evaluated for surgical correction if the patient presents nasal breathing issues. When beginning the surgery, small incisions are made at the base of the nose and inside the nostrils, so we have easy access to the entire nasal structure. The first step of the surgery is to carefully smooth the nose hump, if necessary, with a specific ultrasonic instrument, making the upper part of the nose more fluid and harmonic. The previously printed 3D surgical guides are inserted in order to ensure symmetry and precision when cutting both sides of the bony walls. The intervention employs an ultrasonic device which does not damage the adjacent soft tissues, improving the immediate post-op recovery. Once the incisions are complete, the guides are removed and the nasal bones are repositioned for a narrower and more refined shape. A segment of cartilage is harvested from the septum and hand-carved into 3 pieces. The 2 strips are placed on both sides of the septum to reinforce the dorsum, which can improve aesthetics and breathing. The larger part is for the reconstruction of the tip of the nose, giving structural support and shape in order to avoid laxity or asymmetries, as well as providing long-term predictability of our results. A portion of the lower lateral cartilage is removed on each side, and the tip of the nose is then modeled by sutures to achieve a more refined look. 2 small syringes of blood that were drawn from the patient and processed into plasma membranes are now applied over the new nasal structure before the final skin closure and act as a biological agent, speeding the healing process. The skin is sutured at the base of the nose and inside the nostrils. RevoNose is the result of more than 10 years of experience in rhinoplasty, culminating in a gold standard protocol. Science, technology, and passion to improve quality of life. RevoNose, ultrasonic rhinoplasty revolution.